Hi, I'm State Representative Doyle Heffley, and welcome to this month's edition of Legislative Report. Today we're here in my Lehighton office talking to some of the recovery specialists and treatment specialists here in Carbon County. I'd like to introduce to my left Jess Hansen from PA
Treatment and
Healing, and Jamie Drake from Carbon Monroe Pike Drug and Alcohol, the Executive Director, and Kara Dietrich, who is the Recovery and Resource Specialist.
Yes.
Okay, hopefully I got all the titles right. But basically, I think what the viewers are interested in is what do you see in the community, what type of work he's doing, and overall in dealing with addiction and other services that you provide in the community here in Carbon County. Obviously, probably the biggest thing that you're hearing right now is the opioid and heroin epidemic that we're confronting as a nation, as a state, and also right here in Carbon County. It's the worst opioid epidemic in the history of the world. And some of the things that led to that, and some of the things that we're doing, and how we can celebrate and promote recovery in our communities. So I thank you all for coming here today. And Jamie, if you just want to kind of start off with what your role is and what Carbon Monroe Pike can offer.
Absolutely. Carbon Monroe Pike Drug and Alcohol Commission is a single county authority for Carbon Monroe Pike counties. And what that means is that we receive the money from the state and federal government to provide treatment for the uninsured, underinsured individuals. We also, in Carbon County, have an outpatient treatment unit where we do assessments and outpatient and intensive outpatient, as well as have case managers who help people through the process. We also have recovery support specialists like Carolyn, who work closely with individuals on those non-treatment issues that sometimes get in the way of them being successful, like looking for jobs, housing, issues with their medical assistants, not having medical assistants, and Carol would help those individuals work on those issues. So, we average here in Carbon County at that outpatient office about 200 active clients. In addition, we also contract with Pennsylvania Treatment and Healing for an additional resource. We have been at capacity for a long time, if not on waiting lists, because the number of individuals in this county that are in need of services. So last July, we brought on an additional provider to contract with, and we still are close to capacity. It just shows that the demand for services is so high, and to be able to keep up with that demand. And we're continuing to look at new ways and resources that we can improve services and increase the amount of services that we can offer to the opiate-addicted individual. We're currently looking at a grant through PCCD. We just got support from the Criminal Justice Advisory Board and the Prison Board to look into doing this grant for Vivitrol, which would start individuals on Vivitrol before they would leave the correctional facility and then continue on after they get out. So that's just one of the current things we have going on that's really promising.
Thank you. And Kara, since Jamie had mentioned you, we'll go to you next.
Yeah.
You are a recovery specialist, and also you're very active in the Carbon Recoverers program, which I think is vital to Carbon County.
Right, correct. So at Carbon Monroe Pike, I am the certified recovery specialist, and like Jamie said there, I help out with employment, trying to get the individual in the recovery, help them find employment, help them in the other resources that Carbon County has to offer, and that may be, meeting them at a library or an outside meeting of some sort to help them. And I do Carbon Recovers. I am in my own recovery, so Carbon Recovers is a way for me to reach out to the community and help spread that recovery is possible and break that stigma. It's important for people to know that there's still fun after drugs are gone, and that we can give back to the community. And I did a lot of things that I wasn't proud of in my active addiction, but I'm able to give back now and do good in the community too.
Well, thank you. I think you have to put a face to recovery. Obviously, we're dealing with an epidemic. We had a generation, in a sense, that was blindsided by this opioid epidemic with the advent of the prescription, the Oxycontins, the Percocets, and how we treated pain for many years. And we're still working to change how we treat pain and how that led to the increase in the opioid and heroin addiction and this epidemic we're facing. But we also see a lot of other things. You still have alcohol, which is the number one addictive substance that I think most people are dealing with, and we also have the issues with meth throughout our communities as well. So I think that there's a lot of different facets, but I think it's important that people know that there is help and there are programs out there. And we're going to talk to Jess a little bit, if you want to talk to us a little bit about PATH and the services that you provide and how you contract with other agencies to help.
At PA Treatment and Healing, we do a lot of the same stuff that they do at Carbon Monroe Pike, but on a smaller scale. We provide outpatient counseling, individual counseling, and group counseling. I think one of our biggest assets at our location is we are a little smaller, so we can meet the individual where they're at and just give them the idea too that recovery is possible. We see it every day, all the negatives about it, but I like to shed light on, you can get there. You just have to put a little bit of work into it. And I like to meet them where they're at and just help them along the way, give them encouragement and resources, and just, help them find out that there is life after doing drugs and alcohol. No matter how long you did it or how much damage has been done, you can come back from it.
I think it's important to realize that. I know last week you had the recovery walk here in Carbon County, which has taken off. I mean, every year there's more and more people that are attending that walk and seeing that recovery is an option, and there is hope and light at the end of that tunnel. So what would you say if somebody that is dealing with addiction, or maybe a family that has a loved one that's dealing with addiction, what would be the steps that they can take to start to get that assistance?
I always use the analogy when I talk to people is when you're a little kid and you learn to ride a bike. Not many people get on a bike and take off the first time. It takes a long time till you really get a balance, and that's what the balance in your life is in recovery. And sometimes you fall off that bike, but we're there to help pick you up, put you back on again, and stand by you every step of the way that we can. We really have tried to push the message that recovery is possible for people, and that recovery matters to us. It matters, to everyone that we work with. Everyone I work with in my own agency, people we contract with, we aren't seen as like competing against each other. We're all working together on this problem, and we really invite other people to join us too. We have an opiate task force that meets in the county that's made up of all kind of stakeholders, community members. We've now established a strategic plan and goals, and we're starting to break into committees. One of our first things is to do a stigma survey amongst the medical community as well as law enforcement, so that we can really see where the stigma lies, and then try to develop some kind of initiatives around that to really start to break down that stigma. Because until everyone really realizes that this is something we need to speak out about, not keep secret, we're going to struggle to deal with this problem. That's why I applaud Carbon Recover so much, is because they are speaking out, they're sharing their stories, that recovery is possible and good things happen when you get better.
And for the family member, there's a fine line between enabling and loving too, but definitely support that person and help them through their journey of recovery or active addiction. There's many other resources for family too. There's meetings and support out there for them too.
And I think with the task force, and I've had the pleasure of attending a few of the meetings, but I think it's a good cross-section of providers, but also other community groups, because to really combat this epidemic that we're in, it has to be approached from every angle. You need the law enforcement help, you need the treatment community's help, you need the medical community's help, and we need to provide those access to treatment for those folks that come in there. And if somebody winds up in the criminal justice system, to try to get them through there. And I know Carbon Monroe Pike has a program inside of the Carbon County prison system now to try to encourage people to get into treatment.
Absolutely. We have 2 counselors, one for the male medium block, and we have one for the female block, as well as we also have Kara going up there to meet with people before they leave jail as reentry, to really set things up so they are in a better position to be successful when they walk out the door and not have recidivism back into the prison at a high level. So we were working on improving different programs that we can do up there, sending those staff to some specific trainings around working with the criminal justice system, and that will kind of fall right into place with this Vivitrol grant, which will put an additional case manager up there to work in the jail.
And I think just to kind of explain what Vivitrol is, there's several different types of of recovery and treatment. There's counseling, there's medication assisted treatment such as Suboxone and methadone and Vivitrol. But Vivitrol is similar to what we would call the Lazarus drug, which is the Narcan, which is saving lives throughout our communities right now. And Vivitrol is an agent that would block. If you could just explain a little bit to people understand Vivitrol, it's not the silver bullet, but it is a program that can really increase the success rates of somebody that's in treatment.
Yes, Vivitrol is one of what we refer to as medication-assisted treatment options. Not for everyone. It's just another tool we can put in our toolbox. Really, when we talk about Vivitrol, we're really looking at those individuals who are at the point where they're committed to trying to stay clean. And it is an injection that would again provide a block, but it's a 30-day injection, so you get it once a month from a doctor. Alchemies, who actually makes that pharmaceutical, provides it the first shot free within the jail. And then we would work to get the person on medical assistance in order for us to pay for the additional injections once a month at a provider on the outside.
So it's a treatment. It's a shot that they would take once a month, and what that would do is it blocks, from my understanding, it blocks somebody from wanting, or not from wanting, but from being able to achieve a high. If they're in recovery and they would somehow lapse, it would kind of block them from experiencing that.
To a degree, but it is something that can be overridden, and that's why you don't want to put somebody on it who is not really committed to being clean, because they could override it and could die overdose. So it will be a selective process. It's not going to be every person coming out of the jail is going to be put on that. We also have a Suboxone program at our outpatient office, which will still be an option. And then there are those people who need methadone. They're chronic users that have some other issues, and they need going daily to get that dose rather than being able to have a medication of some sort. So it's a big spectrum. What we're trying to create is that one thing doesn't work for everyone, and we need to give all the different options for people so that they can be the most successful.
And Jess, so if you had a family come into you, what would be your first step in the process when somebody comes in to seek treatment?
If someone's coming in to seek treatment, we obviously do an assessment to see where that person's at. Do they need inpatient, or are they okay with staying in outpatient? And then based on that evaluation, we can contact other inpatient facilities to get them into longer term treatment. Or if they're good for outpatient, we will set them up with an appointment at our center at Carbon Monroe Pike if we're full, or we'll work together. For the family, I would recommend Al-Anon, absolutely. Having been a person who's attended Al-Anon myself, it has been a huge tool in helping me to get through my loved ones' alcoholism, and just encourage them to get counseling so that they can continue to love their addict or alcoholic, but also continue to live their life too. Their treatment has to be separate from the addict themselves. And
one thing that's been made very clear to me when talking to folks like yourself or people that are in recovery or have dealt with a loved one with addiction is that it really impacts the whole family.
Absolutely.
At every level of life. And I know a lot of families now, if they have a loved one struggling with an opioid addiction, are encouraged to get the script for Narcan and keep it in your and keep that in their house, so that if they would need it, and you do provide training right at Carbon Monroe Pike, so they could go out and get that prescription.
Absolutely, we do trainings. Also, anybody can go to a pharmacy, and there's a standing order written by our physician, General Rachel Levine, who, when you go into the pharmacy, they can give you the information, or you can also call our office. We have that number for that standing order, and you can purchase it. If you have medical assistance, it is free with an insurance or maybe a copay. And I am currently also looking at a grant that will provide further funding to be able to fund doses for the community in the form of a voucher that they would take to the pharmacy to fill that standing order. We strongly encourage anyone who is dealing with that to have it, to have that dose, because you are going to be the person that's there first when this happens. It's going to take a while. We live in rural areas for first responders to get there, so family, to me, having it is crucial. I think also something, when we were talking about how do you access treatment, is a really people understanding that if you don't have insurance or you don't have a way to pay for it, that should never stop you from coming to seek treatment. We have funds for people to come to outpatient all the way up to go to inpatient detox, rehab, halfway house, long-term treatment. So, those options are there for people even if they don't have medical assistance or third-party insurance. Kara will help them to get on medical assistance. She'll sit down and do the application with them. In the jail, we actually have a case manager goes up and files it with the person in jail, drops it off to the MA office, and then follows up to get it turned on so people can get out of jail and go directly from jail. So don't ever, anybody, let it be a reason not to get treatment is that you can't pay for it.
Yeah. And I think the passion that you all have it's your job, it's your career in a sense, but the passion that you have wanting to help people.
Right.
And I think it would encourage folks, if you are struggling with an addiction, to seek treatment. Like Jamie said, even if you don't have the resources right now, they're going to help you to find the resources and do everything that they can to get you into some type of treatment format that's going to help you. I mean, we are in the midst of, like I said, one of the worst opioid and heroin epidemics in the history of the world. And the only way to really get out of this is through, getting those folks that have addiction issues and getting the treatment and the recovery that they need. But I thank you all for your time
Can I
today.
give the toll-free number in case anybody 24 hours a
Yes.
day needs it?
Yes, Jamie, go ahead.
24 hours a day, one of my staff is on call at 1-866-824-3578 and can help you to navigate the system, get into services, or just direct you.
Okay. And we will have that number on the screen as well. But I thank you all for coming out today. We'll be back after this short intermission. Hi, this is State Representative Doyle Heffley. I'd like to invite you to our upcoming Drug and Alcohol Expo on Thursday, October 26th at the Palmerton High School from 6 to 8 p.m. At the expo, we'll have information about the ongoing heroin epidemic, tips for parents, Narcan training, and much more. Children are invited to dress up for trick-or-treating. Stop by to learn about what you can do to help prevent addiction in our community. I hope to see you there. Welcome back. I'm State Representative Doyle Heffley, and earlier in our program we had talked to some of the treatment specialists here that serve the area in Carbon County, the 122nd District, and now we're here. We're going to talk to some of the families that have been impacted by this epidemic. And I'd like to introduce our folks that are here today, Michael and Tammy Klein, Rossman Klein, Michael Klein, and Cindy and Lonnie Kester. If you could just a little bit, maybe just tell us what you would say to families and what your experiences are, and how this epidemic has impacted the lives here.
Oh, I would say the impact we had. We lost our daughter, Christine Irby, last January. It'll be 2 years this coming January, and the hardest thing for me was I didn't have the education behind it. I thought, I raised my daughter well, and she followed, the tools we gave her and everything, and it came down to a choice that she made, and she ran after it and in the wrong direction, and she had such a wonderful support group and everything, and she just had a moment of weakness that took her down a bad road, and it ended badly. And if I had the education and the tools, or was more aware of it, we could have prevented it more. And I try to do things still, reading, research and everything, to try and educate myself. And I talk with counselors at Carbon, Monroe, and Pike on different issues on how I could help prevent this as well, because I don't want another family to suffer like we have.
This generation has really been blindsided by this. And so many families that have been impacted by it, and these are good kids from good homes, and it doesn't take much. It's such a highly addictive substance, and heroin has been around for forever. However, with the advent of the Oxycontins and the Percocets and the prescription drugs that are so readily available and easy to access, and once you develop that addiction, it's a physical and a mental addiction, and it's so hard. And I know families provide so much love, and that's why we wanted to have the treatment specialists come in earlier about giving those options out. What can families do? But I think it's important. I think that the best way to get through to the folks that are viewing this, that have children or know somebody that's struggling in addiction, is to put a face on that. Cindy and Lonnie, I know we've talked quite a few times, and if you just want to briefly explain.
Well, we lost our son Lee. It was 2 years this September. And Lee started out, he was in a car accident and had some back injuries, which turned chronic, and he just couldn't get any kind of relief. The doctors, of course, started him on the oxycodone, and from there he went to all different kinds of doctors and therapists, and he just could not get rid of this pain. So the only thing that really helped him was the oxycodone. He kept on that, and to finally the government started cracking down on the doctors of dispersing this medicine the way they have been doing. So when Lee went back to another doctor, he started reducing his meds, the oxycodone, the amount he was taking. He then went to street drugs because he couldn't get it from the doctor anymore. And the street drug he chose was the heroin. Of course, you know, when you're taking heroin, you're going to get caught sometime, and he got caught. And of course, he went to jail, did his jail time, and when he came out, he was completely clean for 3 months, and he was out 1 week. He got something on the street again, and it killed him. He got methadone and laced with fentanyl on the street, and that's what did him in. So just like this family, we really knew nothing about how strong these drugs were. It's prescribed by a doctor, so you think it's going to be something that's safe. The doctor was monitoring him. He was giving him blood tests every month. So we had no reason to think anything bad was going to happen here, that he was going to get any sort of addiction out of this. Till, of course, we start reading up on everything and finding out from other people what was happening in the area. And it really scared us. We hope now that we can do something to help other people, other families be informed. So there's some sort of prevention, some more treatment, some more support, some more compassion with this opiate.
It's an epidemic. I mean,
right, in our area.
Yeah.
So maybe we can help them. We can't help our son anymore, but there's so many other families out there that we'd like to help.
And this is a health crisis of really, I mean, it's statewide. Some people will say what's in this community or it's in that community. I can tell you just from talking with families, it's in every community and every background, and I think the key is to parents, but also to everybody of all ages, that to be very careful with these medications. They were designed for terminally ill cancer patients, and they're highly addictive. And I think it's important that people realize the dangers of them, because it's heartbreaking to listen to stories. And these are young people. This is our future. This is your world. This is your life. And I think it's important to communicate with folks that are out there that are struggling or that have children or a loved one, to be informed and be educated on to what the dangers are. You know, it's not the drugs of the 80s and the 90s that when we grew up was Miami Vice, and this stuff is in your medicine cabinet. If you have it in your medicine cabinet, to take it back to a prescription take-back box, get it out of your home. If it's prescribed, you know, use it very, very sparingly and try to avoid it at all costs. But now, if you could just talk a little bit about your daughter, Christy, and what was kind of her background and who she was.
Christine, this shirt's in memory of her. And when we had her funeral, I had asked everybody, I don't want to see black. I don't want to see those dark funeral colors and everything. She was as bright and bold as a rainbow, full of life, colorful. And I asked everybody to wear tie-dye. I even put tie-dye on her to view her. And my shirt says, "You've changed me forever, and I'll never forget you." And that impact she's had on everybody. Michael's only her stepfather. He's been in her life since she was 9, and she had a great impact on him as well. But a lot of people have come forward to me since her death at my front door in tears telling me I had an overdose, and she sat with me and she talked me through it and everything, but she didn't have those same people or friends to do it for her. And I've never heard a negative thing from her, or about her, I should say, because she always helped everybody else. And to this day, I'm still getting stories about it. I mean, we do everything we can to keep her memory alive. Her ashes are in my angel wings. I wear a picture every day. Michael and I have had shirt sales and hoodie sales to have money raised for the Carbon Monroe and Pike, because that's where she went for treatment. We've recently, in the last 2 years, done Overdose Awareness Day in memory of her, and we push her identity and what she was about, and her story to people, because we don't want anyone else to suffer like that. We're coming up in November, we're having a Bowling for Recovery event in her memory to fundraise more funds for, not just for the opiate abuse and those people, like Jamie had said earlier, it's just, for different things. There's a whole big story. There's so many different addicts and, or alcoholics or whatever. And Christine, she didn't start like, it wasn't an accident. It wasn't, it was, hey, let's go have a party and here's the fun bowl. And it just escalated. And in the end, it wasn't heroin that she was given, it was full fentanyl. And her story, it's just so terrible and heartbreaking, because she didn't look like an addict. She didn't act like an addict. She was full of life, smiles every day, big, beautiful eyes. She was a dancer for 10 years, and that's why I have ballet slippers on the tattoo I got on her, because that was her. And there wasn't a moment that there was a down moment for her. She was always full of life. And when I found out she was a heroin addict, it was after she came home from detox. We thought she was in detox for pills and marijuana or whatnot. And here I found out she was a heroin addict, and that's what broke me. But it drove me to find out more. What could I do for her, and pushed us as well, to help anybody we can. Because like I said, we don't want any parent to have to go through this. It's the hardest thing anybody can endure.
Cindy touched on the subject of Lee being under doctor's care, and the doctor had him on about at least 10, was it Vicodin?
It was Roxycodone.
Roxycodone a day, plus his other drugs, and he was sleeping 20 hours a day. We thought that was the doctor's care, and we didn't really know any better, and we just thought the doctor knew what he was doing. Well, he was medicating him okay, but it really got him hooked on everything. And then after we started investigating, and we saw how dangerous this was, and it was too late. He was under it already, and he told us a number of times he would rather be on the medicine than live with the back pain that he had, because it was irreparable. So I just wanted to point that out. He was a good kid. He's always a good kid, and the drugs won.
It certainly is something that is playing out far too often in our communities, but it's going to take a grassroots movement like we're seeing now with parents that lost loved ones, with the recovery folks that are coming out that are in recovery, and building it up, because we have a lot of folks that are struggling with addiction, and what we all need to do is assist them, whether it be if they're involved in the criminal justice system and getting the resources there to help them, or just through community events like the Recovery Walk, like coming out and speaking about this, and being part of it, and get the message out. So I thank you all so much for coming out and being part of this. And that's all we have for time we have for this episode of Legislative Report. If anybody needs treatment or assistance, there'll be a number flashed on the bottom of your screen, or if you'd like to contact my legislative office for any state-related issue, you can contact us with the numbers on the screen. Thank you very much for tuning in this episode.